Hello everyone. In this video we are going to see about bladder training level 2. So we have already seen how to train the children in level 1. Now we are going to continue the next level, that is level 2. The goal of level 2 training is to help the child to indicate before voiding. That is, we train the child to indicate or express the need to go and use the restroom through various means. It can be using a word or gesture or a sound. So, the goal involved in this level is to make the child indicate to the caregiver that he or she wants to go and use the restroom. So, what are the prerequisites that are needed before training the child in level 2? So, definitely the children, they must have cleared level 1 successfully. So, the child should have undergone level 1 training. Those children will be able to move to level 2. The age must be around 24 and above. So, those children will be able to go through this level 2 training. So, what are the steps involved? So, as we have already done the schedule in level 1 training, we can continue the schedule. And while continuing the schedule, now we have to ask the child whether the child wants to void. So, before taking the child to the specified place, you need to ask the child whether the child wants to void or not. So, to ask the child, to make the child understand what you are asking, we need to use particular word, sound, or gesture. Sometimes we can even use picture of the washroom, because some of these children who have special needs may not be able to understand verbal commands or the names or the words that you are using. So it is important to make the child understand what you are asking by using any one of these means. You can continue to use the particular word or sound or the gesture that you've been using to train the child in level 1, or according to the child's language development, you can upgrade the word or the sound or the gesture that you've been using. Then some children may indicate that they want to go and use the restroom. Some children may not indicate. But you can continue training the children before taking them to the restroom or the specified place. You need to ask them whether they want to do it or not. You can point out to the restroom. You can use actions that are related to voiding. For example, pulling the pants, walking towards the restroom, and things like that. So, after doing all this, after asking the child by giving all these clues, irrespective of the child's indication, you need to take the child to the specified place. Whether the child indicates or not, we need to take the child to the specified place. Now, after taking to the specified place, you have to get the child to remove the pants. So, we can encourage the child to pull the pants down. You can give some help if the child needs, or if the child is not able to do by himself or herself, we can give some help in removing the pants. But we must encourage the child to do so. Applaud if the child voids. Like this, we need to continue this routine for the next 2 to 3 weeks. So basically, in level 1, we are following a schedule. And in level 2, we continue the schedule. The difference is, before taking the child, we need to ask the child whether the child wants to go to the restroom or not. This is done to make sure that the child will understand and will start to indicate to us in some way, using gestures or words or sounds, that he or she wants to void. So, after this routine is followed for a week, the caregiver will be able to understand whether the child is indicating to void or not. Sometimes the child may want to pass urine, so that time he may give a different gesture. And if he does not want to go to the toilet, he may use a different gesture. So, this understanding the trainer will be able to receive after a week of following this schedule. And the caregiver is also encouraged to look for gestures that the child uses. So they may use various gestures like getting down from the cot, pulling pants, going near the washroom, using the associated words or the sound that is being already used while voiding or before the child is taken to the restroom. So we have to be alert and observe whether the child is indicating using any of these methods. Remember to applaud every time the child indicates and voids. So he may be using some gesture to pull down his pants, and then he may go and void with the help of an adult. So every time he indicates, we have to applaud the child. We have to encourage the child by clapping, by hugging, and kissing and smiling and so on. So here in this stage, the child is able to indicate by any means before voiding. If the child is able to indicate before voiding for more than 70% of the time, then the child clears level 2 successfully. And these children can move to level 3 training. This may take 2 to 3 weeks, or sometimes for some children it may even take more than this. So once the child learns the skill, once he is successful in indicating before voiding, we have to continue to remind the child to use the washroom. So once he is successful, we shouldn't leave the child like that. We have to keep reminding the child about whether he wants to go to the restroom or whether he feels the urge to void. So we need to continue to remind the child within the observed time gap, every 1 hour or every 2 hours according to his frequency of voiding. This is level 2 bladder training. We will see level 3 bladder training in the upcoming video. If you have any doubts or queries, you can email at the following address.